Good morning, everyone. I'm Dr. Mitra, your ophthalmologist in Roseville and Grass Valley, my two locations in Northern California. I'm coming to you this Tuesday morning because I had some technical difficulties yesterday with my live video. I did the whole thing. I did it in my Grass Valley location, and anyway, there were some glitches, but this is a story of perseverance. So here we go again. So my practice is Capital I Medical Group. I'm an ophthalmologist. I help my patients gain their best potential vision in order to live their life fully and enjoy their hobbies for years to come. So I have been doing these Facebook Lives. Usually it's a Monday morning at 8 a.m. sharp. And I have been addressing some questions that come up with my patients on a regular basis because as much as I explain things in the office, I think maybe about 20% or maybe 30% may be absorbed, and patients may go home with some questions. So I think addressing these in video format that they can access, that you can access later on, is going to be quite helpful. Also, I want to let you know that, of course, I'm an ophthalmologist, I'm an eye surgeon, but I may not be your ophthalmologist. So everything that I say is mainly for information, educational purposes, in order to equip you with some questions that you may ask from your own eye care provider. So today I'm gonna touch on what is a good eyelid hygiene regimen and why would I even suggest it to patients. So you all may know someone, or you may be experiencing this, where you wake up in the morning and there are crusties or sleepies in the corner of your eyes. Some patients may even complain about the fact that their eyes are almost stuck together, so they have to, wipe it with a warm compress or a washcloth in order to be able to open their eyes. Or throughout the day, if they're contact lens wearers, it's really difficult for them to tolerate the contact lenses over a long period of time. And it's not the fit. They've checked the fit of the contact lens, but there's just not enough moisture or a good environment for their eyes to tolerate the contacts. Some people, their eyes are red constantly. The eyelid margin may be red, and they just feel like they have sandy, grainy feeling in their eyes. Some people have like watery eyes even. So when I tell them, well, the tear film is not adequate, they say, I got plenty of tear film. I don't know what you're talking about. So I go in depth into what is your eyelid anatomy? What is a good tear film in order to keep your eye comfortable? But also what to do when it's not. What is an eyelid regimen that I would recommend? So as far as the eyelid anatomy is concerned, the eyelid itself, especially maybe the first 5 or 7 millimeters from the lashes up, if you look at it on the side, it has different layers. So the front layer, you have the skin, you have the superficial muscle, it's orbicularis, it helps you blink. Then you have the tarsus, which is a strip that goes along the eyelid all the way along the eyeball, all the way across the eyeball. And inside it, you have the layers that have the lashes, you have the oily glands or meibomian glands. Those are the main troublemakers that we'll kind of focus on right now. And the meibomian glands produce the oily material or lipidy material that flows on top of the tear film and keeps it stable. And then towards the back, you have the conjunctiva, which is supposed to be pink and smooth. And for a lot of people, if they're having issues as far as the eye is concerned, that layer may be kind of bumpy, maybe even have cobblestones, almost like that type of pattern, so that when they blink, they feel like there's something just rubbing or scratching their eyes. Or it may be, red because there's a lot of inflammation, there's a lot of blood vessels that have flown into that area. So what is a good tear film? Usually, what are the main components of a tear film? So there are so many components, but we'll keep it to, mainly 3 layers that a lot of times I'll talk about with my patients. So the top layer is the oily layer. or lipidy layer, which is produced by these meibomian glands or oily glands in your eyelid. That's the layer that keeps the tear film stable. It prevents it from breaking up too fast so that you don't have to feel the need that you have to blink constantly, right? The other layers are a mucousy layer and watery layer or aqueous layer. And we may have plenty of those. When you feel like you have dry eyes or your eye is irritated, the brain sends a signal and you get other types of tear glands that start producing the watery and aqueous, watery and mucousy layer. And so you feel like, that's when patients are telling me, no, I've got plenty of moisture. It's, dripping down my face. I don't have dry eyes or I don't have inadequate tear film. Dry eye is a whole other conversation as far as what different types there are, what different treatments. Here I'm trying to keep it reasonably simple with a solution that you may be able to do at in your own home. So what are some of the causes that uh, cause a patient to have inadequate tear film or be uncomfortable? So patients that are contact lens wearers, especially the ones that are not necessarily dailies, maybe they're monthlies, maybe they're rigid gas permeable, you have to go through the proper cleaning method in order to prevent the protein buildup on these contact lenses. So making sure that you follow up with that. Contact lens alone, it can irritate the eye if it's not a good fit, if it stays the eye too long, if you're sleeping with it. All of these things can contribute to the problem. Then, of course, you can have skin conditions like rosacea. That's where it affects the oily glands in the face, but also all the oily glands around the eyelid. So rosacea, when it acts up on the face, which one of the things that sets it off is sun exposure. That can cause inflammation in these glands. It can cause swelling of the eyelid, and once the eyelid swells up, the opening of these glands becomes narrower, so that when you blink, this muscle that goes around the eyelid, normally when you blink, this muscle squeezes the glands and they produce their material into the tear film to make that top layer. Well, when you have inflammation, when the lid is swollen, when the opening of those glands has narrowed, then not everything is going to empty out from that gland. So what's going to happen is you're going to have some material that stays at the bottom of these glands. It doesn't fully empty. It stays in there, becomes dehydrated, and becomes dehydrated, becomes hard, doesn't empty out, and it's a chain reaction. It's a never-ending circle until you kind of stop it at some point. Also, we can have mites, Demodex mites, inside at the base of the lashes. So that's something that when you go for your regular eye exams, I know the thought is a little disturbing, but when you go for your regular eye exams, if you're having, red, itchy eyes, or even the eyes are red, they're just not comfortable, you might want to ask your eye care provider as far as, what may be the cause, what are your risk factors. So, and you might have really thick lashes. You may be using some serums to grow the lashes, or even if you have fake eyelashes that you glue on, or they're, placed on by a specialist, that can cause some irritation in the eyelid and increase your chances of having that inflammation or blepharitis, which then leads to issues with your tear film. So when I have patients that come in and they have these problems, I try to figure out what their risk factors are. Sometimes it's due to allergies. Allergies will cause that pink or conjunctival layer on the inside of the eye to be more cobblestoney, and that will cause them to have swelling of the eyelid, have the blepharitis, and those glands won't work properly. So I try to treat the underlying cause. A lot of times what happens is no matter what the cause is, I still tell patients to start doing this manual labor, I call it, this eyelid regimen at home, because it's something that you can incorporate into your morning, nighttime ritual, and it's something that you can do to help your situation. So what is an eyelid regimen? Basically, If you're doing this in the morning or nighttime, so nighttime, you want to make sure that you remove all makeup, anything, any eyeliner, any mascara, because the pigment from the makeup is going to tattoo the opening of these glands that are all the way across the eyelid. And there's about 80 or 85 of these glands are on each side. So that's a lot of situations where one can get in trouble. So making sure that if you're wearing waterproof mascara, you have a special makeup remover that, can remove waterproof mascara or eyeliner. Making sure you wash your face. In the morning, you might have the crusties in the corner, or you might have the crusties all the way across the lashes. Try and tease that off with like a little bit of warm water on a washcloth. Try to tease that off. And then the next thing I recommend is doing a warm, moist compress. So not just a warm compress, but a warm, moist compress, because that really infuses and goes inside the opening of those oily glands and helps them liquefy. The best, most convenient way that I have found, I've tried this on myself, that I will, do this regimen is by purchasing the eye masks. Some of these you can get on Amazon or from your eye care provider, and basically they're called, one of the more common ones is called Bruder mask, Bruder. Bruder mask, has these beads inside, and it has a little Velcro that goes behind your head, and it's washable, so you can wash it every few times. So you can put that in the microwave, usually about 15 seconds, depending on how your microwave is. Put it in 15 seconds, touch it, make sure it's not too hot. If it's not warm enough, put it in for 5 more seconds, no more than that, because that will ruin the beads. And then when you take it out, have a couple of paper towels that you have folded. You have moistened it and squeezed the water out. I take that paper towel, I lay that over my eyes, and then I wrap that Bruder mask, Velcro it behind my head, and leave it in place until the heat dissipates. Usually that takes about 2 to 3 minutes. Once I take it off, I may even repeat that one more time if I feel like it. And then what I do is, if I don't do anything else, what happens is I've just melted the material, the really thick material inside these glands. That material it's liquefied right now. It's gonna harden up again and nothing happens. So right after I'm done with the warm compress, I'm gonna do eyelid massage to kind of push this material out of these glands. So basically for the lower lid, the glands open up towards the lashes. They're right behind the base of the lashes. For the upper lid, it's the exact opposite. So they're all vertical, right? So for the lower lid, I put my finger on the bone here. I feel that. I look up, I press, hold the pressure, and roll up. Hold the pressure and hold the pressure slow and steady and roll up. And you can go, obviously the eyeball is round, so you're going to go around the eyeball. For the upper lid, 15 to 20 times. For the upper lid, you do the exact opposite. The glands are opening up towards the lashes. You're going to put your finger on the lid crease, press, hold the pressure, roll down, hold the pressure, roll down. And you do that 15 to 20 times. So how much pressure, some people ask, how much pressure should you put on the eye? Well, it's enough pressure where things get a little bit double. You're not going to hurt the eye. How am I going to see anything come out? No, you won't. But what you will feel is that as soon as you're done with this, because you've pushed out that oily, thick material, it's going to be swimming into your tear film. You're not going to see it. It's just going to make your eyes blurry until it drains off to the side. You can even close your eyes and just kind of dab the tissue in the corner. And so unless you have a slit lamp like I do at work, you won't be able to see it, but I promise you it is working. How long do I do this? Well, it's something that you're going to do long term. So if you're having the symptoms that I talked about, the red, itchy eyes, all of that, or even styes, you're going to start doing this at least twice a day, morning and nighttime. I would say after about 10 to 14 days, you'll notice a difference. And the difference is going to be pretty subtle. So let's say you tell me that you're putting in eye drops, artificial tears to lubricate the eyes 6 times a day. Maybe you don't even remember to put them in, but maybe 2 to 3 times a day. So that's an improvement. That's a metric that you're going to use. Maybe you do a lot of work on the computer and you feel like, oh yeah, I don't have to take as many breaks. My eyes don't bother me as much. Or you're a contact lens wearer and you have noticed that, when you had to take your contacts out by 2 p.m. and put your glasses back on, now you can go further. So these are all metrics that you can use to see whether or not your eye is more comfortable. Um, so it's not like you wake up one morning and boom, everything is better. So if you're doing it twice a day, you want to get to a maintenance point where your eye is comfortable, you're maintaining the health of your eye, and you're preventing disease by doing this eyelid regimen, right? Because that's the whole purpose, is prevention. And maybe you want to cut it back down to once at bedtime or just once in the morning. I suggest when you take a shower, assume that your shower is your warm compress, warm moist compress, and at the end of your shower, go ahead and do the lid massages. That's just a bonus right there. You might as well. So these are hopefully some helpful methods to help with the health of your eye. Maybe you won't have to see me as much, but if you are looking for an ophthalmologist in Northern California, or you have a friend or family member that could benefit from these videos, please share this with them. Make some comments and let me know what subjects you want me to go over, what things have puzzled you. I've done some videos about cataract surgery in the past in several episodes, so that would be helpful for me to make sure that I'm serving you and helping you gain some information. So reach out to me if you want to reach me. My website is www.capeyemed.com, CAPEYEMED.com. My Instagram handle is at Mitra, MITRA, MD3, the number 3, and I would love to hear from you. Thanks for watching. Make sure that you make your appointments with your eye doctor. Make sure that you take care of your eyes so you won't have to see us in an emergency. Thank you so much. I'll see you next Monday at 8 a.m.